You're listening to Soundside. I'm Gabriel Spitzer, in for Libby Denkman today. The Trump administration's health policies are upending years of advice about COVID vaccines. Since they've been available, the recommendations for almost everybody have been get the shot. It helps keep you out of the hospital. Might even save your life. But now federal agencies are taking a much narrower approach. Health Secretary Robert F. Kennedy Jr. just announced the vaccines won't be recommended for children or for healthy pregnant people. And the FDA plans to approve booster shots only for older adults and people with extra risk factors. They say we need more research to show that otherwise healthy people will benefit from the vaccine. Well, Dr. Helen Chu has a pretty unique perspective on this. She is a professor of medicine at UW, and she's run several landmark studies on how COVID spreads. She's with us now to help make sense of these changes. Dr. Chu, welcome back.
Thank you. It's nice to be here.
So let's just tackle this head on. RFK Jr. announced yesterday, alongside NIH Director Jay Bhattacharya, that they decided to stop recommending vaccines for healthy kids and pregnant people. And they said that this decision was common sense and good science. So what do you make of that? Do you agree?
Well, I would strongly disagree. I think the reason why we have COVID vaccines for young children and for pregnant persons is because we know that they work, that they're safe, they're effective, and these are populations that are at high risk for severe disease. In fact, very young children, especially those under 6 months of age, are one of the groups that's at highest risk for severe disease. And vaccinating the pregnant person protects both the pregnant woman as well as the infant.
So RFK Jr. says that for healthy children, COVID just isn't an issue anymore. I mean, do you disagree with that?
It's actually not true. So children, infants who are under 6 months of age actually have the second highest rate of hospitalization for COVID, just behind those of older adults. So they are at high risk. And children with comorbidities are also at high risk for hospitalization and severe disease. And especially in young children, it's very hard to tease out who does and does not have a comorbidity, whether or not they have chronic diseases is something that we think about in adults, but in children that's harder to figure out. So a recommendation where you say every child should get a COVID vaccine and be up to date for their COVID vaccine is probably the most straightforward way to protect everyone.
The change is especially striking for the recommendation for COVID shots for pregnant people, which as recently as like last week, generally pregnant women were seen to be at much higher risk for severe disease and were recommended to get the shots. This week, no longer. What do you make of that about face?
Well, I think the facts still show that pregnant persons are at high risk for severe disease and that giving a vaccine to a pregnant person is safe and effective in protecting them as well as their infant. The change in recommendation from last week to this week is striking, and I'm not sure what to make of it. But I think focusing on the fact that we know that this is an extremely high risk group, this is a group that should get COVID vaccines. And hopefully there will be discussion and deliberation about the right approach.
Yeah. And it's a little tricky to keep all the different recommendations straight. So I'm going to try, and you correct me if I mess it up, okay? But the CDC and the Health and Human Services Department made this decision not to recommend it for those two groups, healthy kids and healthy pregnant people. The FDA is now asking the drug makers to do more clinical trials before they'll approve boosters for most healthy adults under 65. So what do you make of that? I mean, is more research really needed? And I mean, what could be wrong with wanting to know more?
Well, it's not that we don't want more research. So the way that vaccines are currently approved for use in the United States is that first they are deemed safe and effective at the FDA. And then the CDC makes the recommendations for which age groups or which high risk groups should receive the vaccine. And so those are two separate types of recommendations. What's come out in the last week is actually highly unusual because neither of these sets of recommendations seems to follow the usual pathways by which Health and Human Services makes decisions about vaccines. In terms of the extra testing that's required, I think in many ways that's simply not possible. The way that we approve vaccines in the United States is through traditionally randomized clinical trials, like we had very early in the COVID-19 pandemic. But then after you've done that first set of trials, For most of the updates in the vaccine, so the changes to strains that happen year to year, we can't run that type of large scale trial. That takes months, it takes hundreds of thousands of individuals. The amount of time it would take to run that trial every single year for every single update of the vaccine would be cost prohibitive and essentially undoable because you can't get the trial started, completed, and analyzed in time to be able to then make the vaccine for that season for use in that exact same year. The time scale is not possible. So the way that we now handle it, as we do for flu vaccines and updated COVID vaccines, is we look at the antibody response to the updated strains and we make sure that people are able to mount a good immune response to the updated vaccines. And based on that immunologic data, that laboratory data, we say this vaccine works. And that's the traditional path for how we update seasonal flu vaccines every year. And that is the path by which we have been updating the seasonal COVID vaccines every year.
So you start out with a big randomized controlled trial, and then as you update the vaccine, you're using lab results to check in and make sure it's still working?
That's correct.
Well, does it make sense to revisit the big picture at some point? I mean, it's been 5 years. We have a very different kind of immunological picture in the United States now than we did 5 years ago, with most people having had COVID. Most people have had at least a few vaccine shots. I mean, hasn't the cost benefit analysis changed in some ways?
I think it's fair to have the discussion about what types of things we want to measure now. Remember, back in the day, we wanted to prevent hospitalization and death. We wanted to prevent severe disease. But COVID does not cause hospitalization and death in the majority of healthy adults anymore. So we want to think about what are the other things that we want to prevent? Do we want to prevent long COVID? Do we want to prevent transmission to other people in your household, such as vulnerable people like older adults or babies? There are other ways that we can measure how well a vaccine works. And you don't need a large scale randomized clinical trial where one half of the population gets a placebo. You can measure it in other ways. And that is what a lot of the frameworks in the United States, particularly put together by the CDC, those frameworks do measure how well do vaccines prevent these other things. So those are the types of studies that we should be doing. We should not be starting over. It's not ethical at this point in the pandemic to be giving half of the population a placebo because these vaccines are effective and they're safe. And we can't give saline placebo when we know that the intervention is protective.
Well, that's interesting. So it's not just a logistical question of the money and the time that it would take to do those trials. You're saying it would be unethical to basically deny the vaccine to half of the trial group.
That's correct.
So there was a while earlier in the pandemic when, new variants would come along every couple of months, it seemed like, and outsmart the old shots to some extent, reduce the immunity conferred by the old shots, and you have to go out and get new shots. That seems to have stabilized largely. But what are the chances at this point that there could be a big mutation that would require, a major reformulation of the vaccine?
Well, anything is possible. These are viruses that mutate very quickly. But for the last several years, all of the variants that have been circulating have been Omicron subvariants. So essentially derivatives of the same Omicron variant. The things that do lead to high rates of mutation are unchecked spread. So if you take away vaccine from the population as a whole and allow COVID cases to increase in the community, it leads to more and more transmission. And with more and more transmission, there's more and more chances of mutation. So I don't know that we want to go there, though. I don't think we want to be put in a situation where we allow the virus to mutate as much as possible.
What does it mean that the federal government won't be recommending these vaccinations or that the FDA won't approve the shots for certain populations? They're not banning them. They're not turning them into an illegal substance, right? What does it actually mean for like a person's ability to get those shots? How could it make their lives more complicated?
So right now, all of the information that has come out is, as I've said, not through the traditional pathways by which we normally license and approve vaccines. So normally what happens is that a vaccine is licensed by the FDA, and that's often based on this immunology data that we get. After it is licensed, then the CDC votes on whether or not it's approved for certain populations or the population as a whole. Once the CDC approves this vaccine, then it is covered by health insurance and people can get the vaccine. But until that step happens, the COVID vaccine is not going to be covered by health insurance. The issue that we're running into now is that a lot of the information that's come out in the last week hasn't really gone through the normal pipeline of licensure and recommendation. So we don't know what that means for vaccines in the fall. As it stands currently, the FDA just met last week and they voted to update the variants for the fall booster vaccines. And CDC is meeting in a few weeks to vote on the recommendation for its use. So that's still following its normal pipeline. I'm not exactly sure what's happening here in the last week with Dr. Bhattacharya and RFK making the proclamations that they did. I'm not sure how that plays into whether or not vaccines will be available.
Interesting. So you don't necessarily take this as face value that this is what's going to happen. There are still processes that are set to play out at the agencies.
Yeah, I mean, this is just not how we license and approve vaccines in the United States. There are standard processes. This is not that standard process.
Well, what do you tell friends at this point when they ask you about getting the shot? Let's say they're a healthy adult without any other extra risk factors. Should they still be getting updates every year or so?
I think it depends on your situation. So who do you live with? What do you do for work? Are you going to be exposed to older adults? Are you a healthcare worker? I think that there's a lot to consider. The easiest thing is to talk to your physician, decide on whether or not the vaccine is right for you. For me, as a healthcare worker and as someone who is substantially concerned about the risk of long COVID, I would certainly get my booster because there's plenty of data to show that the higher your antibody, whether from booster or infection or whatever source of boosting of your immune system, the higher your antibody titers, the more protected you are from all of these outcomes.
So, Dr. Chu, you sit on the advisory committee for the CDC, the Advisory Committee on Immunization Practices. Ordinarily, that body of experts has a really important role to play in approving vaccines and deciding what the most appropriate recommendations are. It sounds like those processes, those protocols are have been kind of sidelined. Why do you think it's important for a body like ACIP to have a major say in these decisions and that they don't just get made in the offices of RFK or the head of NIH?
Yeah, so the goal of the scientific advisory boards that support the CDC and the FDA, both so ACIP and VRBPAC for FDA, is that it is a group of independent experts who are outside of these agencies. And the process by which this usually happens is that the data is presented to this independent group of experts, and then there is a period of scientific discourse, both between the experts and then also with the general public. The general public is invited to these meetings. These are publicly available, and people submit questions and feedback. And so it is this level of scientific discourse, which is very transparent, which involves all of these different groups, the CDC, the public, experts who are outside of the CDC. And that is how decisions are made. So what's different about what is happening now is that that process is not being followed. And so it puts us in this unusual position of having been on these committees to not know what to do because the processes that are now happening is that information is being shared. But this process of sharing with the public and engaging in open scientific discourse, that part has not happened.
Do you feel like you're working in some kind of a parallel universe where you're in this deliberative process and then you open the paper and there's an announcement, or you turn on, you call up X on your computer and there's an announcement that sort of short circuits the whole thing?
Well, I just try to stay off X.
Well, we've been talking with Dr. Helen Chu about the changing guidance around the COVID vaccines. She's a board certified physician and a professor of medicine at the University of Washington. Dr. Chu, thank you so much for being here.
Thank you for having me.
Thanks for listening to Soundside. This show is only possible because listeners support us. If you're able to give right now, please check out the show notes for a link to donate. And don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m., Monday through Thursday, or anytime online at KUOW.org.